Hi, my name is Mike Pishvaian. I'm an associate professor in GI medical oncology at Johns Hopkins University School of Medicine. Pancreatic cancer is unfortunately a devastating and deadly disease and is soon to be the second leading cause of cancer-related death in the United States. But I see optimism and hope in the treatment of pancreatic cancer because we actually have had improved outcomes over the last 10 years. And now, for the first time ever, we're starting to see some exceptional responders or long-term patients who benefit from different therapies. I've had the good fortune to have a few patients that have had metastatic disease and yet have had long-term control of their disease, meaning years, with different types of therapies. Now, in general, these are patients whose tumors harbor specific biomarkers that predispose to specific targeted therapies. The largest subgroup of this is probably those with an underlying DNA damage response repair pathway mutation, such as BRCA1 or BRCA2. And those patients treated either with platinums or with PARP inhibitors can have very good long-term control, and in some cases, even complete response, meaning complete regression of their cancer, and again, sometimes for years. I do have one patient now who was identified as having pancreatic cancer. It was metastatic at the time of diagnosis. She started FOLFIRINOX as standard therapy, but in the process, we also tested her tumor. Interestingly, she did not have a germline mutation in BRCA, one of the BRCA genes, but she did have a somatic, meaning tumor-only mutation in the BRCA gene. And after a period of FOLFIRINOX, she was able to enroll in a clinical trial of maintenance therapy with a PARP inhibitor. And it's now going over 3 years that she's had actually no visible disease on scans while she remains on this PARP inhibitor. I have had other patients on other targeted therapies who've had really outstanding responses and in some cases complete regression of their disease over a period of time. Now, we don't know yet whether we can actually cure patients with metastatic pancreatic cancer by giving them these targeted therapies, or if patients who've undergone surgery and have certain targetable mutations, whether the cure rate can be increased by adding some of these targeted therapies. But as one example, there's a critical clinical trial that's about to get started for patients who've undergone surgery for their pancreatic cancer. If their tumor harbors one of these BRCA1 or BRCA2 or PALB2 gene mutations, if the patients receive chemotherapy and then after chemotherapy, they get a targeted therapy with a PARP inhibitor, will that actually improve their cure rate? And hopefully we can make some progress in that subgroup of patients, as well as several other biomarker-based subgroups of patients as well.